topics of the day. I am Geet from Beautiful Spotless Skin team. I am sure all of you must be keeping good health. Welcome everyone to our special Instagram live session. June is not just any other month, but it is considered as Acne Awareness Month, dedicated merely a surface issue, but it can deeply impact one's emotional well-being, one's psychological well-being, and much more. Beyond the physical blemishes, it can erode self-confidence, leading to anxiety, depression, and even social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why June, especially this month, serves as a beacon of education and advocacy aiming to dispel myths, promote understanding, and empower individuals to seek effective treatments. Today we are diving into the topic acne management with our skin expert. Whether you're struggling with breakouts yourself or simply curious about maintaining clear, healthy skin, this session promises to be both informative and engaging. So today we have our expert, Dr. Pooja Desai, a renowned skin expert from Ahmedabad. Dr. Pooja Desai is a dedicated dermatologist specializing in the development of effective treatment plans for patients with skin and genital diseases. Known for her personalized patient care, she excels in providing quality service and communication, helping patients overcome fears and stigmas with patience and compassion. Dr. Desai's expertise spans various fields of dermatology, clinical dermatology, dermatopathology, dermatosurgery, and aesthetic dermatology. She completed her MBBS at Pramukhswami Medical College, Gujarat, and her other degree, which is MD in dermatology, venereology, and leprosy at GMERS Medical College, Sola Civil Hospital, Ahmedabad, Gujarat. Currently, she serves as a consulting dermatologist, venereologist, and leprologist. Her achievements include presenting numerous papers and posters at national and international conferences. Today, we are eagerly waiting her insights into acne and its active management. So, without further ado, let's kickstart the session. Welcome, ma'am, on board. So, ma'am, today we are talking about on such an important topic, acne. And as I said in my introduction, that June is Acne Awareness Month, where we are talking about the management of acne. So, I would like to kickstart the session and ask you my very first question: that what exactly is acne, and your views on how we can manage acne.
Okay. So basically, acne is a form of inflammation that occurs in your pilosebaceous unit. What is the pilosebaceous unit? That you have hair follicles all over your body. It contains a sebaceous gland along the sides of hair follicle. There is inflammation in the sebaceous gland. There is overproduction of sebum, that is generally we called as oil, and there is a clogging of your hair follicle opening that can lead to problems like blackheads, whiteheads, we usually called as uh, open comedones and closed comedones, then papules, a little spongy type of things. And then there is a pus-filled pimples that is called acne. So there are various stages of acne from starting from the blackheads in later to the comedones and the nodulocystic acne, where the multiple large cyst-like conditions on your face, chest, and upper body.
Okay.
Also, that your back also. So generally,
Okay.
yes, please.
Ma'am, what are the types basically of acne we would want our viewers to know? I guess there are multiple types, but only people only know the some mere or like the basic types. So because we have you on board, so definitely we should talk about the types also.
According to like generally, the doctors type acne according to the grading from grade 1 to grade 4. Like if you have majorly of black or whiteheads, generally that is called as as I usually mention, that open comedons and the closed comedons. That is the grade 1 acne. If you have small reddish pimples like without any pus field, that is grade 2 acne. If you have a combination of red pimples and with pus filled lesions, that is called grade 3 acne. And if you have larger lesions like sebaceous cyst or more of cystic kind of lesion which ooze a lot pus and this stays for longer time, that is grade 4 acne. That is also called nodulocystic acne. It feels like there is a node in your cheeks. And if we go according to age, there is a neonatal acne which occurs in the newborn babies. There is infantile acne. Usually there is a hormonal funcies, like जो हम बोलते हैं फुंसी फेस पे होती है, a plain reddish papular lesions. Adolescent usually there are majorly two types of acne in the age group. That is adolescent acne, which occurs during 10 to 19 years of age, and there is adult onset of acne, which occurs more than 25 years of age. So both has different mechanism of getting acne. Both has different hormonal influences. So basically, adolescent acne are self-resolving, and adult acne are a little resistant to treatment. So according to age, we can also consider the acne problems, and according to grading. And there is also another entity called acne rosacea. That is a different entity from the acne vulgaris. Generally, pimple in the later called as जो हम पिंपल्स लेटम में बोलते हैं, यूजुअली मेडिकल टर्म में उसको हम एक्ने वल्गारिस बोलते हैं. और दूसरा टाइप आता है एक्ने रोजेशिया. यू कैन सी द कभी कभी लोगों को पिंपल्स जैसे फुंसियां होती है, बट दे sometimes they flush during sun exposure or eating a hot meat. That is acne rosacea. That is a very different entity from the acne vulgaris. So first of all, person who have acne like lesions, they have to meet their doctor and first consider the proper diagnosis. Merely this is normal acne vulgaris or it is acne rosacea. So basic
Okay.
difference we should know.
Okay. So, ma'am, often we have seen the acne is more on the cheeks and the face, right? So, what is the specific reason behind the entire when the skin is filled with acne and we can't help it, but there are small spots as well. So, what is the main specific reason to that?
So main specific reason to that is we have abundance of sebaceous gland more over the face rather than the rest of the body. And second, there is the sebaceous glands over this face are more of under the influence of the hormones.
Okay.
That's why we're getting too much of acne over the face.
Okay. And ma'am, does the environment also play the vital role in this, the environmental factors or the sunlight?
Definitely, environment, like if you are in the hot, humid climate, you will get more acne. If you have a very, what can I say, if you are in the sunlight, definitely you will get the more acne because there is a production of oxidative stress and everything. Increased sebum production, there is inflammation in the skin. So that can also lead to a more and more of acne.
Yes, and ma'am, as we are on the subject of the same, some people sweat a lot. So is it the combination of skin or the type of skin that the oily skin people are more prone to acne? Because this is usually a myth that dry skin people doesn't get much acne. So what
So it
is
is
this
definitely a
misconception?
myth that oily people have, they are prone to have acne. Acne can occur in the dry skin, mixture of skin like combination skin and the oily skin. Because acne
Okay.
doesn't, acne can't be only because of your oil production, the sebum
Yeah.
production. It has
Yeah.
multiple modalities.
Yes. So ma'am, can you please tell us about the grades of acne?
Okay, so I already mentioned that that is a grade 1 which has a comedons, normally the black and the open edge. If there is a black occurring product from your skin, that is blackhead. If there is a skin overlying your comedons, that is closed comedons, that is grade 1. If you have more of papular lesions which are in the pink or red in color, they are the grade 2. If you have more of pustular lesions, which has more of filling in the lesions, that is grade 3. And if you have nodes or cystic like lesions, that is a grade 4. And other than there
Okay.
is a clinical acne, which includes your back and upper chest.
Yes. So, ma'am, what are the prevention methods for acne so that we can not attract so much of acne either on the face or skin or any grade for that matter?
Okay. So basically, acne is because of hormone. Adolescent acne are more of hormonal regulation that occurs during our puberty. So basically, we need to control our hormones, which is not in our hand. So acne
Right.
usually occurs according to study, 85% of population or adolescent population has acne, right?
Yeah.
We can prevent uh, further damage of our skin, not the acne.
Yes, definitely.
So that is a myth that we can prevent our acne by this or that. No, we can prevent further aggravation of our acne, or we can prevent further damaging of our skin. So first of all, we need to change our little bit lifestyle, and the food modification is there. Like there is a little exercise in your day-to-day routine. You should you should take a less amount of high glycemic index food, like a very processed sugar food or dairy products. There are some studies who claim that if you're taking more and more of dairy products and more of processed sugar products, you will have a more acne because of high glycemic
Yeah.
index, right?
Correct.
You have a PCOS like of thing like polycystic ovarian disease or a syndrome. You need to consult your gynecologist, and you have to evaluate yourself for the further hormonal test. If you have hormone-induced acne, then we can manage by giving you a hormonal therapy. If you are asking me for the normal adolescent people, so we can ask them to don't freak or don't pop up your acne, to maintain proper hygiene. Don't touch your face regularly with unhygienic hand. Regular face wash should be done like twice a day. More of home remedies like besan, lemon,
Yeah.
and tomatoes and everything, because that can clog your pores, that can increase your inflammation, that can damage your face more. Right?
Okay. So basically, ma'am, we should avoid all this
All these things,
applying.
definitely,
Yeah.
definitely.
Okay.
You should avoid these foods which I have already mentioned, the unhygienic touching of your face and applying multiple things to your face.
Yes. So, ma'am, definitely, as we are on the subject of it, we are speaking about adolescent acne. So, we have usually seen when the puberty is hit and when the children starts growing up, suddenly overnight that happens that their face is filled with acne. And before that time, before their time, they have nothing on the face. So, usually the parents are also tense and the child
Right.
is also very
Right.
tense that suddenly why my skin is behaving a certain way. So, ma'am, why is that difference?
So first of all, parents usually forget about their time and they are only
Yeah,
focusing on children's time, right? So
yeah,
basically, there is a production of androgens during the puberty. Your adrenal glands usually produce androgens during the puberty. That's why we are getting some features like axillary hair, beard hair, pubic hair. That is a sign of your puberty. Females come for the menarche, like menstruation starts around the puberty, right? So there is a
yeah.
change of hormones in your body that can lead to increase a production of your sebum, that is a oil, and there is also dysregulation in your follicular opening. So there is an increase of keratinocytes. What can I say in a normal term? जो आपका ओपनिंग होता है फॉलिकल्स का, उसमें देर इज क्लॉक फॉर्मेशन बनना शुरू हो जाता है. आपके जो केराटिनोसाइट्स मतलब नॉर्मल जो स्किन सेल्स होते हैं वो डिस्लॉज होकर वो इंफेंटिबुलम में आ जाते हैं और दैट कैन क्लॉग योर पोर्स. तो नीचे जो सीबम प्रोडक्शन हो रहा है ऊपर जाने की जगह नहीं है. देर इज मोर एंड मोर ऑफ सीबम प्रोडक्शन. Eventually there is a bacteria called Cutibacterium acne which resides in your sebaceous gland that can also increase in the production. So eventually these things com combinationally lead to acne formation, not merely because of your aging, because of your hormones that are have a regulation or your sebaceous gland, your skin cells. Eventually they lead to acne.
ओके मैम, हम बात करें ऑलरेडी ट्रीटमेंट और प्रिवेंशन के बारे में डेफिनेटली अबाउट एक्ने, बट आई ऑल्सो वांट टू गाइड द व्यूअर्स अबाउट द प्रोसीजर्स of acne treatment. तो मैम क्या procedures हैं for the following?
Okay. So for the acne, we'll start with the first like grade 1 acne. Usually we'll do a manual extraction of comedons. So
Okay.
usually I explain the patient like comedons are the first step of your acne. They in future can leave you a scar or more of pustular pimples or nodulocytic acne. They can convert it into anything. So we'll start with the manual extraction of the comedon. Second, we can do a microdermabrasion that can give you a proper comedonal expulsions. Third is I generally do a cellipeel, that is a chemical peeling procedure, or the black peel for the acne according to the grade of the acne. So both can give you a proper subsidence of your ongoing active acne or also prevent the further aggravation of your acne. There is also, if you have more of inflamed acne, we can go for the IPL, that is intense pulse light therapy. It is a kind of machine therapy. We can go for normal home procedures, like if you have scars, we can go for the CO2 fractional laser, or we can go for the MNR, that is microneedling with radio frequencies. There is a light therapy also available, blue and red light therapy according to your acne types. So there are multiple therapies according to skin type, your severity of acne, we can go for.
Definitely. And ma'am, usually when the acne goes by all the treatment, maybe topical treatments, but the scars usually remain.
Like,
So what should we do for the scars?
so scars are three different types. One are the ice pick scars, we are the very small pitted scars. There is a rolling scar which has a shallow center and the margins are almost the slopy ones. That is called the rolling scar. And then another is the very resistant scar, is the box scar. You have clear cut margins. That is the box scar. So for different scars, we have different modalities. If you have ice pick scars, we can go for the TCA cross. That is a chemical reconstruction of skin scars, that is a full form of cross. Then another, for the rolling scars, we can go for the PRP with derma roller, PRP with derma pen. We can go for the fractional CO2 laser. We can go for the microneedling with radio frequencies, that is called MNRF. And for the box scars, there are multiple modalities like subcision. We have to cut down your fibrous strata below the skin. There is a punch excision of your large scar, punch elevation of your scars, and we can go for the combination of therapy according to your scars, because no person have a single type of scar. There are multiple scars in the single patient. So we
Yeah.
have to combine the treatment according to the patient. We have to manage the treatments.
Yeah. So ma'am, sensitive skin की अगर हम बात करें, if you talk about sensitive skin or people like who have sensitive skin, because I have a very sensitive skin, and whenever I eat something oily or something like that, the other day one pimple or one spot arises, and I'm sure many people are struggling with that. So what do people with sensitive skin and acne do?
Okay, those people who have sensitive skin and they are they have purging of acne, so they can use a mild cleanser rather than using a harsh cleanser with salicylic acid or so. Because if they use a harsh face wash or cleanser or exfoliator, they will feel more inflammation and more purging of acne. They can use
Right.
a mild version of treatment which is given by a doctor, or the contact period should be less in the sensitive people.
Okay.
Like if we are
And
using retinols, so there
yes.
should be a less contact period. And
Yes, and ma'am, the tissue, napkins, and these things definitely has to be taken care of. The tissues, napkins, and people who usually pass on this.
I have already mentioned about the hygiene. So you have to take care of your tissue napkins, your pillow covers, and your bed sheets, everything.
Yeah, yeah. So, ma'am, is there a maintenance therapy also for acne?
Yes, there is a maintenance therapy. Usually, I provide the patients a normal topical retinoids, that like tretinoin or adapalene, to maintain their follicular keratinization, which I already said as the skin cells and sebum production. And there is a normal face wash or mild exfoliator we can give them for the maintenance therapy, not the
Definitely.
proper treatment. The single cream or face wash can be used for the maintenance therapy rather than going for multiple the trends which are right now ongoing on social media, the
Yes.
2 times exfoliations and everything.
Okay. So, ma'am, as we are on the subject of the same, we are living in the social media age where there is a skincare routine being promoted everywhere. The AM routine, then there's the PM routine. So, how important is the skincare and how important is moisturizer as well as sunscreen?
So skincare definitely it is a huge role in our normal healthier skin. But so we have to use a normal cleanser for your face or a face wash to remove dirt or excessive oil from our skin. Right? That is the first thing. Second, we maintain hygiene by normal face wash or cleanser because there are multiple bacteria on our face. So to maintain their normal microbiome, we need to clean our face regularly. That is a twice a day is optimum time. More and more if you are going to wash your face, that will lead to a more and more dryness or the inflammation or some kind of skin damage. Moisturizer is definitely needed because healthier skin should be moistured first. Second, if there is any insult to your skin in the form of acne or in the form of procedure or anything, healthier skin or the moisture skin heal faster than the dry skin.
Yes.
Prevent any further inflammation after getting acne or after getting some procedures done on your face. The moisturizer is the must, right?
Yes,
To maintain
definitely.
the proper moisture of your skin that will heal faster.
Okay.
It is sunscreen. Sunscreen is must because we want to prevent a pollution dirt to come on your face and increase more and more acne by clogging your pores or giving them inflammation or in a some another way. And to also minimize the post-inflammatory pigmentation because of sun, because we are getting pimples. That means there is some insult in our skin. We usually find that after resolving our pimples, we find there is a pigmentation, there is more and more of dull skin because sun damage is more in the inflamed skin than the normal skin. So sunscreen is must.
Okay. And ma'am, we also discussed that sunscreen and moisturizer definitely is a must for every skin type. But when it comes to acne, what specific sunscreen or moisturizer or what ingredient is necessary so that we can apply it when we have acne as well? Because when considering online or in the market, there are multiple options right now. And
Yes.
different formulations are there, gel based and spray based, and so much that audience usually gets very confused while choosing the right cream for themselves. So, what would be the perfect option for the people who have acne?
Okay. So for the people who have acne, they should first see the box or the packaging. It should be mentioned that there is a non-comedogenic or
Okay,
oil-free. That is the must.
all
If you are using any sunscreen, moisturizer, or even makeup products, you should
okay,
look for the prescription that there is a non-comedogenic or oil-free products.
okay. Oil free and non-comedogenic, as you said, would play a vital role in helping them. And water resistant and oil free somewhere similar or they are poles
Very
apart.
different. Water resistance means if you are sweating or if you are diving in the uh, sea or in the swimming pool. Water resistance means it will give you protection after you are under the water. That is a water
Right.
resistance. Or if you
Okay,
are sweating a lot. Oil free is your product is not going to clog your pores.
right. Okay. So oil free is the must to check in any moisturizer and sunscreen as well.
And the makeup
Definitely.
also.
Yes. And when we were speaking about diet, as I told you that my skin usually by eating oily food or spicy food gets breakouts. So does diet also play a very important role in acne development?
Yes, that has a role, but it is still a controversial topic for the acne. But there are multiple studies who have said that if you are taking dairy products like a skim milk, there is more and more production of your acne. If you are taking processed sugar, which has a high glycemic index, so you will get a more acne. If you are taking a whey proteins, there is also chance of getting acne. And there are people who are going to gym and taking some kind of proteins or steroids. They will also have a more and more of acne.
Definitely. So, ma'am, as diet is very important, a balanced diet, I feel definitely is
Balance
important.
diet,
And go,
yes, balance diet should include more and more of fibers because you, if you are constipating, then also you have a more acne.
okay. Yes, depends upon the lifestyle we are definitely living in. As you mentioned, gym as well, ma'am. So, any lifestyle changes we should do to reduce acne, you would suggest?
Definitely, you do some kind of exercise at least 30 to 45 minutes a day that will maintain your normal circadian rhythm of your body. That will little reduce a lipid from your body. That is a more, those who have more and more kind of overweight, they also have more of purging of acne, or there is also some kind of hormonal imbalance. If you are doing exercise regularly, there are chances you will get your hormone.
Okay, so as ma'am mentioned that various things for the lifestyle changes, the personal hygiene, the maintenance therapy for acne management, there are multiple things which we have to do. One has to do on a regular basis, on a day-to-day basis, so that we don't get the acne. Yes, ma'am, as you were speaking about various lifestyle changes.
Okay. So basically, we need to maintain our proper healthy lifestyle by doing some exercise like 30 to 45 minutes. We should maintain good proper sleep, that is 6 to 8 hours a day. We should refrain ourselves from getting more and more of stress because stress can also aggravate your acne. If you have less sleep, that is also a sign of you're getting more and more of acne. Your digestive system should be in proper frame, like you don't constipate regularly, because if you are in a constipating state, you will have a more and more of acne.
Definitely. And ma'am, as we were speaking about lifestyle, various therapies, various things to prevent, I guess our viewers who are battling, like managing acne every day, their social confidence also sometimes gets very low. The self-esteem gets very low because when in events, when we go to public spaces, definitely the skin is the first thing which we notice in each other. So various questions from our viewers today is also there. As you were speaking about acne scars, Pooja from our viewers is asking, how can I prevent acne scars?
Okay. So usually acne scars occurs due to your skin tendency, majorly of skin tendency. Some people have acne, but doesn't have a scar because their skin heal that way. But if you want to definitely prevent acne, so you shouldn't prick your acne or you shouldn't pop out your acne.
Okay.
Manipulation lead more and more of acne scars rather than applying just the normal creams or prescription by the doctors. If you manipulate your pimples more, they will definitely leave behind your acne scars.
Okay. And ma'am, overnight if we get just one pimple and people have the habit of pricking it, or there are certain, these days there are certain masks or just a chits are there. So should we use that or it will self-heal? How do we go about that?
So if you are single, acne usually that occurs during, if we are females, before the menstruation there is a few breakouts will be there. If you have some big event coming on, there is some breakouts will be there. You can apply a pimple patch there which has a salicylic acid, or you can just apply a normal cream which has prescribed by your doctor. There is also creams available that you can apply on your pimples that will reduce their size.
Yes.
But don't prick it. That is must.
Okay.
It can render you more inflammation or
Okay.
that
Ma'am,
create more infection.
Yeah, any natural remedy or any home remedy, because many people do, like we were speaking about basin or applying something at home. Many people have this tendency also to apply something through their homes, like a home remedy sort of things. So, do we believe in that, or we should totally skip that?
So I'm very much against of using some kind of home remedies because I have seen so many of people getting like very much of inflammation, acne outburst after doing these home remedies like besan, lemon, because lemon has citric acid, tomatoes, again it is a kind of citrus fruit. So that can
Right.
give you more and more inflammation rather than giving you help with your acne. And besan can clog
Okay.
your pores. You should eat more
Okay.
and more of lemon or tomatoes. That will give you more
Yeah.
vitamin C that has antioxidant properties.
Yeah, instead of applying it externally, one should keep it inside, like have it in the food so that
Right.
it can help. Mithali from our viewers, ma'am, has another question. Doctor, any key ingredients for fighting acne? Any
So,
key ingredients?
and a single three ingredients would be not merely for any of your problems. We need to have a combination of therapy. If you have plain normal comedons like grade 1 acne, you can go for the retinoids. But I would always recommend it everyone. Please go check your skin with your dermatologist and then use something. Merely using single product will won't give you that benefit.
Yes,
When you
definitely.
find main three ingredients, main uh, single product, if you are asking me, then tretinoin would be the best.
Okay. And when people who are living away from home and usually are eating so much junk food or traveling a lot, they do not get a chance to eat a balanced diet or a diet full of fibers and protein. So, any ingredient or anything for them to just take care of their skin on a day-to-day basis.
Okay, so they can use like they can take vitamin C chewable tablets because
Okay.
vitamin C has very good of antioxidant properties. They can you are like they can eat something which is a little healthy. They can add some salad in their food that will balance their dietary fiber proportion. If
Okay.
these two things they should uh, do daily in their routine life. But if they are away from their home, there is a stress anxiety is there. There is outside food is there. There is lack of sleep, traveling. So
Yeah.
they need a
These
proper
lifestyle
a
changes,
little balance.
these lifestyle changes, I guess, can definitely exaggerate the problem.
Yes,
Definitely. Well, Anika from our viewers is asking, can sun exposure worsen the skin?
yes, definitely.
Yeah, yeah,
Exposure can lead to a multiple of problems like from tanning to sunburns, increase in inflammation of your ongoing acne. There is acne breakouts. There is exaggeration of acne. So there are if you have acne rosacea, then definitely you should avoid the sun because that can also increase your acne rosacea and facial fur.
yes. Definitely. And one more question from our viewers. Seema is asking, is there any link between the hormonal changes and acne? And when postpartum, which is post-pregnancy, also women get a lot of acne. So is there a constant relation, especially in women, with the hormones or the mood swings, or maybe when we are in the menstruation period? So
Definitely,
usually, or we have to step out of a house on a very important day, then suddenly one pimple pops out.
definitely, yes. There is always a hormonal role with our acne. That, as mentioned, I have already mentioned in the puberty area, like at the age of puberty, we are getting pimples because of our hormones. There is a adult acne which occurs beyond 25 years of age. That is also because of your hormonal imbalance in the body, or there is a hormonal uh, a little hormonal imbalance. After postpartum, there is also huge change in your body because of your hormones. Definitely, because of there is a key role between your acne and hormones. There are studies who have shown that definitely people are getting premenstrual flare-up and the premenstrual 2 or 3 breakouts. That is a
Yes.
usual thing.
Yes,
You can see my face
definitely.
there is a pimples because of premenstrual flare-up. That is seen.
Yes.
But if you are not popping it out or if you are not breaking it out, it will reside by them cells own and they won't leave you any pigmentation or the scarring.
Okay. And ma'am, certain medicines if you are taking on a day-to-day basis, so are there any side effects of the medication that can lead to acne?
Yes. Already I mentioned that steroids. If somebody is on
Hmm.
anti-epileptic therapy like phenytoin or something, they are also in a verge of getting acne. In steroids in any form, in a protein powder or the normal tablets, they are getting. They definitely will get some kind of acne. If you are taking whey proteins as a medicinal form, then and then also you have you will get acne. If you are taking some kind of hormonal pills like oral contraceptive pills, that is also a sign that you will get a few acne or acne exacerbation.
Okay. Ma'am, usually people have this idea of skin glow and skin being healthier that they think there should be sudden food that we should consume and post that we wake up with a glowing skin. So that is why one interesting question from our viewers has come up that doctor, there is any food to avoid for clearer skin or glowing skin. So
Sugar,
any food,
sugar,
yes.
high sugar.
Okay.
It's
Okay.
yes, there is a trend in social media that you should avoid sugar, but definitely there are scientific reasons behind that you should avoid a high consumption of sugar and precisely more of processed sugar.
Okay.
And
Like the
eat
Tetra
normal.
Pak sugar.
Yes,
Like the Tetra Pak foods. Yeah.
yes, definitely, definitely.
So, ma'am, what is the entire science goes behind it that people with sweet tooth has more acne, or is there any science behind it, or just like the natural thing is to avoid?
Yes, no, no, no. You if you are taking high amount of sugar, that means your though if you are taking some food which has a high glycemic index, that will increase more and more of insulin like growth factor ILG. That is a little bit of theoretical knowledge I'm giving you right now. So that insulin like growth factor has a role on your hormones and on your sebaceous gland. So there is a interlink between your high sugar content and your acne. Definitely.
Okay. Now, one more question from our viewers about washing the face. So, how often should we wash our face? Can you please explain on that?
Generally twice a day, one in morning and one after coming to a home. Up 2 times a day is very optimum. If you are doing more and more of face wash, then you definitely will have some kind of dryness problem or the inflammation.
Okay. So,
Don't
ma'am,
be
this was
OCD oral. Don't be so OCD about your face wash. That is my suggestion.
yes. So again and again, people usually think that washing the face maybe thrice or 4 times a day can help, but definitely 2 times is must, and
Must
they should.
2 times is
Yes.
optimal. And
Okay. So, ma'am, this was so much information about acne and its management. But before we close, I would request you to give any closing remarks or your advice to the people who are struggling or dealing with acne and your advice to manage their acne properly.
okay. So no home remedies. So first, starting from first. The first, no home remedies will give you a proper cure from acne. Uh, we cannot prevent our acne, but definitely we can prevent aggravation or getting some post-inflammatory pigmentation or the scars. Usually, adolescent acne are self-limiting; they resolve by their own. But why the treatment is needed? Because we don't want to have acne scars or pigmentation after resolving them. Right? So that's why for adolescent acne, we should go visit our doctors. For if you have hormonal acne that is or adult acne that is above 25 years of age, you should consult your dermatologist and gynecologist both because no merely normal acne treatment will resolve your acne. You need to have some kind of hormonal therapy for the hormonal acne that will give you good effect. Fourth, there should be a proper skincare routine, not as mentioned by some so-called influencers on the Instagram. You should visit your doctor according to your skin type. You should manage your skin wisely.
Yes.
But over exfoliation or over cleansing can lead to a more and more purging of acne or more damage to your skin rather than giving you any good health. And sunscreen is must in any scenario. And look for
Yes.
the products who are non-comedogenic or oil-free. That is a
Okay.
synonym in your normal moisturizer, sunscreen, and your makeup products. And
Definitely.
wash your makeup brushes regular basis.
Yes, ma'am. And this is, I guess, one very important thing to wash the brushes regularly, which is you mentioned, because many people usually just do a lot of makeup and then the hygiene factor is there. Yes.
Definitely. And second, there are also acne pads available. If you are not getting too much time for washing off your face, there is a acne pads who have salicylic and glycolic acid in them. Just wipe it off. There are also availability of that pads in the market. You can ask your doctors to prescribe some to you. And the another thing is, don't apply this like Colgate. I have seen so much of people applying Colgate and baking soda to your the face, but it is very, very matlab, disheartening to see them applying this Colgate and everything. It won't affect your skin in a good way. Definitely, it will affect in a bad way. That is sure. Second,
Yes.
scalp should be regularly clean. If you have more and more of dandruff, you will feel more of acne purging, and if there is more and more of truncal acne, that is acne on your chest, upper arms, and the back.
Okay. Got it. So, ma'am, as you mentioned, Colgate, like various things are the myths we were talking about. One, I guess, is this most prominent thing, Colgate, and these things which are being used. So, I guess definitely. And one more very interesting thing on this note, where we discuss that do not listen to anybody online, but definitely visit your dermat and get the right combination and types of your products for your skin. So thank you so much, Dr. Pooja, for your valuable time. And it has been very, very informative session for all our lovely viewers. And it is definitely great to hear from you. We look for many, many more such sessions in the coming time. Thank you for all the viewers also for joining in for their excellent participation. Be connected to our beautiful spotless skin page. Thank you so much, ma'am.
Thank you so much for being good host, and thank you so much for the good informative questions also.
Thank you so much, ma'am. We look forward for many more sessions, and I hope from sessions like this, we are spreading awareness and helping people manage their acne.
Yes, definitely. Bye. Take care.
Bye, ma'am. Take care.